Hi there, this is Jonathan Ginsberg. I'm an Atlanta area Social Security disability attorney. And today I'd like to talk to you about winning strategies, things that have worked for me in the past, when you have a low back injury and you're pursuing Social Security disability benefits in the Atlanta area. And not surprisingly, low back injuries, low back pain, damage to your lower back, your spine and your lower back are the most common reasons that people file for Social Security disability. And the good news on that is that judges recognize that low back injuries are pretty significant and can be the cause of disability, and they're very familiar with the medical aspects of it, of the looking. They're used to looking at MRI reports or looking at medical reports dealing with low back pain and so forth, and that's a positive. The negative is that because judges see so many low back injury claims, yours has to stand out a little bit. You can't walk into a disability hearing and say, I've got low back pain, I'm disabled, pay me. You've got to have evidence. And typically what I'm finding, the evidence that I think works and the strategies that work best would be, you need to have, first of all, some evidence of a significant problem. And the best evidence is going to be an MRI report or a CT scan, something that shows there is some problem in your lower back, ideally a herniated disc or a badly bulging disc, something that is that's significant and it's consistent with complaints. And the type of complaints that would be consistent with would be radiating pain into your lower legs, into your legs, radiating pains into the buttocks, problems using the restroom. It could be urinary problems, either difficulty starting a urinary flow, or it could be difficulty controlling your urination, incontinence. It could be fecal incontinence as well, sexual dysfunction. These are all indicia of a serious back problem that is causing nerve issues and with functioning, because again, disability is about functioning, and so if you're having difficulty controlling your urine, it's going to suggest as well you're going to have difficulty sitting or standing for any extended period of time in a work environment. So that's the level of problem that we need to see. A herniated disc or multiple herniated discs, and again, typically it's going to be at L5, S1, or it could be at L4, 5, or it could be at multiple levels in the spine. And I'm going to talk in a different video about the cervical spine or the neck, but just for the lower back, that's typically what we're looking at. What we also look for, what I look for, is that you're treating with an orthopedist or a neurosurgeon or even a neurologist that is looking and doing tests to determine that you've got problems with the nerve conduction, with the nerve functioning, or that you have a spinal cord impingement or scar tissue formation that's causing problems with nerve conduction in your lower back. Again, that's causing some of these issues. And usually the protocol would be, if you have an injury, whether it's a lifting injury or a fall or an accident, it could be an on-the-job accident or a car accident, or even just sneezing the wrong way or bending over the wrong way, the first thing the doctor is going to do is they're going to send you for physical therapy. They may then send you for an epidural injection after a few weeks or months if the physical therapy doesn't work. Then they may send you for some sort of pain management where they're trying to help you deal with the pain and not go through surgery. And then after that, they may go for surgery. And typically a surgical order may come down the pike at about 4 or 5 months out. It could be a little sooner, but usually it's 3 or 4 months out, where doctors are trying what is called conservative treatment, again, the physical therapy, the epidurals, because a certain percentage of back injuries, even serious ones, can resolve themselves. Either the disc material is absorbed, or you learn to live with the pain, or the type of impingement on the spinal cord is not significant enough to cause you problems with your functioning, and that does happen sometimes. So again, what I'm getting at is that a herniated disc alone is not going to win your case. I always tell people the diagnosis does not win the case, it's the symptoms you've got. And so those are the symptoms we're looking for, is problems in the lower extremities, difficulty walking, again, the urinary issues and so forth. forth. You can also have problems with medication side effects, because narcotic pain medication can be very constipating. It can cause problems with attention and concentration and focus. And of course, back pain can be excruciating. It can cause problems there with attention, concentration, focus, memory, ability to get through a workday without needing to take breaks. And you need to be very specific about how often you have to lie down, how often you have to take a break from work. You got to be very specific about how long you can sit, stand, how much you can lift, can you climb ladders, ropes, and scaffolds. All these things, all these functioning issues are things that we would talk about and try to enlist from your doctor support in the form of a functional capacity evaluation, where we're going to ask the doctor to confirm that you have lost significant function in your body due to your lower back injuries, and that you have pain that is so significant that it makes it difficult to concentrate and focus. Those are the ingredients to a winning case. It's not just walking in there and saying, "Judge, I got a MRI report of a herniated disc." We got to have more than that. We've got to have your testimony about the functioning problems that you're having because of this back injury. We've got to have evidence from the doctor that they've tried all types of treatment, again, the epidurals, the physical therapy, it has not worked, that the pain medications are not allowing you to fully restore your function, and that you're basically in a situation where you're either in bed all day, or more typically you're in a recliner all day, that you're not able to function at work, and if you were able to go to work, you would only be good for maybe an hour, 30 minutes, an hour and a half at most, and you have to keep taking unscheduled breaks or missing excessive days from work. That's the recipe for a winning low back case. I hope you found this helpful. If you did, please give it a thumbs up on YouTube, like it on Facebook, subscribe to my YouTube channel, and like our Facebook page. And if you have any questions, leave me some feedback. I'm happy to try to respond to that. If you have any questions for me personally, call me. I'm at 770-393-4985. I'm in the Atlanta area. I handle cases in the Atlanta Downtown Hearing Office, Atlanta North. I'll go to Gainesville. I'll go to Chattanooga. We'll go to Macon, Columbus. I'll go to Athens. So anything in North Georgia, if you are pursuing Social Security disability in the North Georgia area and I can be of assistance to you, please call me, email me. More than happy to talk with you about your case and give you some advice about what you might do to win disability. It's a very long, drawn-out process nowadays, but if you have the right evidence and you have the right preparation and you know what you need to say to the judge, you can still win these cases, and it can really make a difference in your life, having some money coming in and let you live with some dignity. Again, if you need me, reach out to me. And if I can be of assistance to you, please call me or email me. Happy to help you in any way. Another thing I would ask you to do, if you haven't already done so, go to my website. It's ssdanswers.com, ssdanswers.com/Atlanta. There I have a free Secrets to Winning Disability Survival Kit. A lot of good information about what I've learned over the past 25 years in pursuing disability claims. I think you'll find it very useful. You can download that at no cost, and it'll come to you by email. You'll get a lot of good information out of that as well. So again, my name is Jonathan Ginsberg, Social Security disability attorney here in Atlanta, and I look forward to working with you soon. Thanks a lot. Hi, this is Jonathan Ginsberg, and I hope you found this video helpful. If you'd like to know more about how to win your Social Security disability case, I'd like to invite you to download my Secrets to Getting Approved Early Survival Kit that I created just for people like you. Currently, I'm making the survival kit available at no cost, and I encourage you to grab your copy now. Some of the topics I cover include: how do I know if I have a case? Is it the right time for me to file my claim? 9 common mistakes that can doom your case. The 3 must-have arguments you use to win your case. And a topic that every disability claimant wants to know: how to avoid trick questions from the judge. If you or a loved one need to win Social Security disability benefits, you'll find the Survival Kit essential reading. Download your Survival Kit right now and at no cost. Just visit ssdanswers.com/survival and sign up. It's that easy. Please act now. And as always, I wish you the best.